Hi, I'm State Representative Ryan Mackenzie. Welcome to another episode of Legislative Report. Today we're here on site at St. Luke's West End Medical Center in South Whitehall Township. I'm joined by Jeff Kowalski, who's the building manager for St. Luke's West End Medical Center. Thanks for joining us, Jeff.
Thanks for coming, I appreciate it.
Absolutely. Well, St. Luke's is one of the largest employers here in the Lehigh Valley. Thousands of employees at multiple locations. Tell us a little bit about the St. Luke's network.
St. Luke's right now employs over 9,000 employees, which we're very proud of. Right now we have presence in 2 states, 8 counties in Pennsylvania, 1 in New Jersey. We're standing outside of West End Medical Center, which is our newest and one of our biggest outpatient medical facilities.
Yeah, so it's 108,000 square feet of space. Had a long history, somewhat back and forth. There was the Builders Square, Pennsylvania Convention Center, so lots of different lives, but now we see that it's been brought back to life as West End Medical Center. Tell us about how you revitalized and reclaimed this property, which was vacant for many years.
Well, I think this property is a great example of private and state legislatures working together. We used the RCAP grant, $2.7 million to get this facility back. It's thriving, patient volumes are up. It's just a great combination of people working together for the state and the local community to ensure great quality health care for people.
Absolutely. Well, it's a beautiful facility. It has a lot of services to offer. So why don't we take a walk inside and you can tell us a little bit about more what patients can realize and utilize here.
Sounds great. I'd love to show you around.
All right, we're here inside, Jeff. It's a beautiful facility, like we said, outside. Gorgeous on the inside as well. Why don't you tell us a little bit about the different services that are offered here?
It is. It looks great. We did a great job with this, I think. Right here, we're outside the radiology suite. We're a proud partner of GE, so we get their latest and greatest equipment delivered to our facilities first. So it's a great test site for the GE material. We're really proud to be a partner with them. Also inside the building, we have pain management. We have neurology that comes in that does assessments on patients. We have an OB suite where it's a private practice, so OB/GYN care is here. We also have St. Chris urgent care. We have a laboratory that takes blood specimens and things like that. You also have X-ray, radiology. We have our Care Now facility that's open 7:30 to 10:30, 7 days a week. That cares for patients that have minor bumps, bruises, sprains. Inside there, we do occupational medicine. So we take care of a vast array of patients all through the building. Coming into this building soon will be orthopedics. We'll also be dialysis, and we'll look at moving in women's imaging in the next year. So it's going to be a great opportunity to expand our services to the local community and increase the St. Luke's brand as we go forward.
Absolutely. So a huge amount of services that are offered here. What are the hours of operation for all of those locations?
Most service lines are open 7:30 to 10:30. That would be our Care Now facility, our radiology. Our lab is open 6:30 to 7 o'clock in the evening. Ultrasound we also have here. We do ultrasounds and vascular ultrasounds. That's open 10 to 6 Monday through Friday. Most of the private practices, the pain management, the neurology, and the OB/GYN, they're open more business office hours from Monday through Friday about 9 to 6.
Great. And so how many people are employed here?
Inside this facility right now we have about 50 to 60 people working in here. It's going to vary based on our volumes. Touch on our volumes, we have increased, we've gone past the volumes that we projected, which is really nice. So it's a great thing for St. Luke's, great thing for St. Luke's Allentown, and great thing for the actual facility.
Absolutely. Again, great reutilization of the space that was here, and we're glad to see so many patients coming in and already utilizing your services. One of the interesting things is a pediatric care unit here, and it's a partnership that you have with St. Christopher's Children's Hospital. Why don't you tell us a little bit about that?
Proud partner with St. Chris. They opened in the summer of 2013 with us. They're also doing very great service to the community. Board certified pediatric emergency physicians only are seeing their patients. We also have some specialty care with St. Chris over at our St. Luke's North building in Bethlehem. So our relationship with them continues to grow, and we're going to prosper together. But they're a great resource in the building as well. Fantastic.
And it's the first pediatric care unit in the area? Or?
It is.
Okay, great. Good. Well, we're glad that that's here. Now, you mentioned Care Now. That's one of the more active lines here at the West End Medical Center. So why don't we go check that out?
Sounds good.
All right, Jeff, we're inside St. Luke's Care Now. It's the walk-in urgent care portion of this facility, and we're joined by Dr. Robert Delansky, who's the network director for urgent care here at the facility. Dr. Delansky, tell us a little bit about your background and profession. I always hear from students in our community about their interest in going into certain fields. Sometimes they're interested in the medical field. Tell us a little bit about your background and how you got into the position you're in.
Sure. After medical school, I came to the Lehigh Valley and did my training in family medicine. Throughout the years, I've been doing a little bit of work on the side in the urgent care world. And a year ago, they asked me to move into this full time, and it was a great fit for me. So I made the jump, and it's been a great pleasure working in this field.
What types of patient care do you offer here, and do you see most coming in?
Well, just what Jeff mentioned, but oftentimes we have kids who get sick in school, mom or dad call their family doctor, they can't get them in right away, so they bring them here. So we'll see them for coughs, colds, bumps, bruises, minor laceration repairs, a lot of sports injuries.
Okay, and do the patients have to be a part of a network, or can they just walk in on their own?
No, they can walk in on their own.
Okay, well that's a huge benefit for our community. And have you seen, what's the response been like from patients? Do they prefer this setting, or?
It's been a very positive response because the family doctors are getting much busier and harder to get into. And we are very convenient as far as hours go. We do also offer a small line of generic prescriptions, so the patients can possibly get their prescription while they're here and they don't have to make another trip to the pharmacy.
Jeff, what do you think has really been the benefit to this for St. Luke's as a network in the larger picture here?
I think it's just putting our brand more and more in the local community, giving great care, easy access to make people have quality health care from our organization. Customer service is outstanding. One of our benchmarks of who we are is our customer service, and this facility and this service line has been a great example of our customer service and our commitment to patient care.
Great. And so is this a trend that you see St. Luke's going into more of these facilities, the Care Now facilities?
That is very true. We are looking to expand the St. Luke's Care Now brand into all of our markets, and I think that's going to be happening over the next 12 to 18 months, where you see more facilities of St. Luke's Care Now popping up in neighborhoods near everybody.
Great, great. And as you mentioned, huge demand for it throughout the community, so obviously something that you're looking to do more of, so that's good. Good. In addition to all of the medical services offered here at St. Luke's West End Medical Center, there's also a healthcare facility right here. And so right now I'm joined by John Graham. He is the director of the Sports and Human Performance Center. John, thanks for joining us.
Thank you, Representative Mackenzie. Glad to be here.
Absolutely. Well, why don't you start out by just telling us a little bit about the facility?
Sure. Well, the really amazing part about this facility is our leadership here at St. Luke's wanted to develop a facility that really served our community in a comprehensive manner. And when I say that, meet the fitness needs of everyone. So our administration came to me and said, what are we going to do to serve the needs from the youth all the way up into the senior population, and from very low levels of fitness to very high levels of fitness? So we went and partnered with some very prominent national organizations like Life Fitness and Perform Better, and developed a facility that we feel accommodates the needs of every clientele who might be interested in fitness programming. So our programs actually serve the youth population, we serve the general fitness population, we serve the medical fitness population, which is individuals that have chronic disease and disabilities, which now affects 50% of our population approximately. Wow. And then in addition to that, we focus on our senior population as well as our elite fitness population. So it really becomes a melting pot of fitness when you come in here on a day-to-day basis, because you'll see someone who's very highly fit to someone who may be using breathing devices to get through their exercise program. But everybody has those goals and objectives of how they want to improve their level of health and well-being.
Yeah, that's great. And the facility's been recognized with some awards recently, isn't that correct?
Both Perform Better and Life Fitness recognize us as national training centers. And we've actually appeared on front covers of fitness catalogs as well as fitness calendars. So our facility has really gotten a lot of national recognition in a very short period of time.
Well, that's fantastic. You've been open about a year now?
Since November of 2013.
Great. Well, we're glad you're here in the community. And why don't we take a walk around and you can tell us a little bit more about the facility here.
The way the facility was designed was, when we put it together, we wanted to really kind of set up the facility in such a way that people could progress in levels of exercise intensity. So at the start of our facility at this end, we start out with our cardiovascular training equipment. So we have our treadmills, our bikes, our elliptical trainers, but we also have things that are unique, like new step trainers, which allow people who may not be ambulatory to use a piece of equipment that incorporates their upper and lower extremity. So a good example would be someone who has multiple sclerosis, who has difficulty functioning or ambulating correctly, can get on a new step and really get a beneficial effect, not only with their upper extremity, but even their lower extremity, which may be debilitated by the course of their chronic disease or disability. And then as you walk to this end of the facility, you start to get into our strength training area, which we use everything from selectorized equipment to plate-loaded equipment, down to our freeway training equipment. And the idea being is that our selectorized equipment allows people to safely exercise and use resistance training equipment without having to worry about balance and stabilization. But then our plate-loaded equipment allows them to individualize different parts of their body so that we can selectorize or utilize pieces of equipment that allow them to get the maximum benefit out of their training program.
Wow.
And the other benefit is that our staff really takes a personalized approach with every client that comes in. So when a client joins our facility, the first thing we're going to do is we're going to assess their level of fitness. We have 7 different fitness testing batteries that we're going to implement for them. So everything from a youth fitness testing battery all the way up to an elite level fitness client to a sports client will have a specific testing battery.
It seems like you're really a lot more involved with the health science of exercising here than some other facilities. Is that one of the key differentiating points?
Well, one of the things, and I go back to what our administration was looking for, is we wanted to develop something where we could use outcomes measurements as a tool. Everything in medicine is about outcomes and getting good results and getting good quality care for their patients. So our hospital system said we need to do the same thing in our preventative departments as much as we do in our clinical departments and our acute and chronic care departments. So our fitness programs really focus on the same mantra and the same philosophy from a mission and vision standpoint as our hospital system does. We want to get good outcomes for our clientele. So when you come to our fitness center, our goal is to help you to improve your BMI, help you to improve your body composition, drop your blood pressure, improve your heart rate, help you to drop your cholesterol levels and things along that line, as well as enhance your overall fitness and improve the aesthetic qualities that a lot of people associate with an improved fitness level, like losing body weight and changing your sizes on your clothes and things along that line.
Great. Well, I see you have some facilities for some classes and some workout.
We have a group exercise classroom that allows not only a changing in temperature based on the type of class. So if we have a yoga class, we may want it to be a little warmer than we want for spin classes. But we also have lighting controls in there as well, so we can control the mood of the room as well. Some classes, they like it very bright, a lot of lighting. Some classes like it a little bit toned down, so we'll actually drop the lighting based on the type of class that's in there at any given time.
All right. Well, this is a very interesting part of the facility. It's the sports performance area.
Well,
Tell us a bit about this.
The facility is designed so that, as you can see, our control desk sits right in the middle of the floor, so our staff can manage both sides of the floor. But as you come down to our turf area, we have a 60-yard turf surface. And everybody said, why did you pick 60 yards as the surface area? Well, a lot of the sports teams that we work with, the kids have to be able to get tested in a 40-yard dash. So because, once again, we're focusing on outcomes measurements, we wanted to be able to measure 40-yard dashes.
Sure.
So a lot of sports performance training areas that you'll go into, they don't have this much turf space because they don't worry about necessarily measuring a 40. Well, if a 40 is what a kid's going to get measured in, we need to be able to test them and measure that.
All right. Well, I'm going to ask, how fast can you run the 40?
Well, I haven't ran them in a long time.
Okay.
So, not sure at this point in my stage, but in my younger days, I was able to do pretty well being a football player at the college level and things.
Great.
But our fitness center is when you get into our sports performance area, we set this facility up so that we could accommodate teams. And we had teams here in the winter months that had as many as 40 or 50 participants at a time using this facility all at the same time. And that's really important to us because we want to be able to bring people together and train them as a group as opposed to just having them come in and do one-on-one workouts. And the coaches like it because obviously they can bring all their teammates, all their teams in at the same time.
So you're training some fantastic athletes and some future superstars right here. We're glad that you were able to show us around today, John. Really appreciate the opportunity. So I want to thank you for that and keep up the good work.
Thanks, Representative Mackenzie.
All right, and thank you to all of the viewers at home for joining us again on an episode of Legislative Report. I'm State Representative Ryan Mackenzie, and we'll see you again on another episode of Legislative Report.